Epilepsy is a chronic neurological disorder characterized by recurrent and unprovoked seizures. These seizures are episodes of abnormal electrical activity in the brain that can affect behavior, sensations, movements, and levels of consciousness. Epilepsy affects people of all ages, genders, and ethnicities, and it is one of the most common neurological conditions worldwide. According to the World Health Organization, WHO, epilepsy affects approximately 50 million people globally. Though it can develop at any age, it is most commonly diagnosed in young children and older adults. Despite its prevalence, epilepsy remains widely misunderstood and stigmatized in many parts of the world. Causes and risk factors. Epilepsy can result from a variety of causes, though in many cases, the exact cause remains unknown. Known causes include genetic factors. Some forms of epilepsy are inherited and can run in families. Genetic mutations can make some individuals more susceptible to seizures. Head trauma, serious head injuries from accidents, falls, or sports can lead to epilepsy, especially if the brain is damaged. Brain conditions, tumors, strokes, and other disorders that affect the brain can increase the risk of developing epilepsy. Prenatal injury, brain damage before birth due to infection, poor nutrition, or oxygen deficiency can lead to epilepsy in children. Infections, meningitis, encephalitis, and neurocysticercosis, a parasitic infection, can cause epilepsy, particularly in developing countries. Developmental disorders, conditions such as autism and neurofibromatosis are associated with epilepsy. Types of seizures. Seizures are the hallmark of epilepsy. They are typically categorized into two main types. Focal, partial, seizures. These originate in one part of the brain. They can be simple focal seizures, where consciousness is preserved but may include abnormal sensations or jerking of a limb. Complex focal seizures, where consciousness is impaired and may involve confusion or automatic movements. Generalized seizures, these affect both sides of the brain and include tonic-clonic. Grand mal involves loss of consciousness, body stiffening, tonic phase, followed by jerking movements, clonic phase. Absence seizures, petit mal brief lapses in awareness, often seen in children, where the person may stare blankly for a few seconds. Myoclonic seizures, sudden, brief jerks or twitches of muscles. Atonic seizures, sudden loss of muscle tone, leading to falls or head drops. Tonic seizures, sudden muscle stiffening, often resulting in falls. Clonic seizures, repetitive jerking movements. Diagnosis. Diagnosing epilepsy involves a detailed medical history and several diagnostic tests. Key steps include medical history, a detailed account of the seizures, including their onset, duration, and triggers. Electroencephalogram, EEG. This test measures electrical activity in the brain and can help detect abnormal patterns associated with epilepsy. Brain imaging, MRI or CT scans may be used to identify structural abnormalities, such as tumors or scar tissue. Blood tests, to rule out infections, genetic conditions, or metabolic issues. Treatment and management. Although epilepsy has no cure, most people with the condition can manage it effectively with treatment. The main approaches include medication. Anti-epileptic drugs, AEDs, are the primary treatment. These drugs help prevent seizures in about 70% of patients. The type of medication depends on the seizure type and individual response. Surgery, for people whose seizures do not respond to medication, surgery to remove the affected brain tissue may be considered. Vagus nerve stimulation, VNS. A device implanted under the skin sends electrical impulses to the brain via the vagus nerve to reduce seizures. Ketogenic diet, a high-fat, low-carbohydrate diet has been found effective, especially in children with certain types of epilepsy. Lifestyle changes, regular sleep, stress management, avoiding seizure triggers, and adherence to treatment are crucial. Living with epilepsy. Living with epilepsy can be challenging, particularly due to its unpredictability and the social stigma associated with the condition. People with epilepsy may face restrictions on driving, employment, and social activities. Emotional and psychological support is often necessary. Education and awareness play a vital role in helping society understand epilepsy. Many people with epilepsy lead full, active lives, especially when seizures are well controlled. Conclusion: epilepsy is a complex disorder with various causes, types, and treatments. Though it can have a significant impact on a person's life, with proper diagnosis and management, many individuals with epilepsy can live independently and productively. Ongoing research continues to advance our understanding of epilepsy, offering hope for better therapies and, eventually, a cure. Public education and the reduction of stigma are equally important in ensuring that people with epilepsy are treated with compassion, dignity, and respect.
Thank you for watching. Please subscribe our channel.